As a brain doctor, I must tell you something that many people never realize until it is too late. Stroke is not always an event that strikes without warning. In many cases, the body whispers danger days before the attack. But those signals are often overlooked or dismissed as fatigue, stress, or aging. Every year, countless lives are lost because these warnings were ignored. Stroke remains one of the leading causes of death and disability worldwide. Yet it is also one of the most preventable when early signs are recognized and acted upon quickly. Imagine this. Brain cells begin to die within minutes when blood flow is cut off. But the body often gives you clues a week in advance. Sudden weakness in the face, numbness in an arm or leg, blurred vision, dizziness, or a severe unexplained headache can appear briefly and then fade. These moments may seem minor, but they are not. They are alarms, telling you that a major stroke could strike at any time if no action is taken. The tragedy is that too many people dismiss these signals as harmless or temporary. In reality, they are the most important opportunity you have to protect yourself. Recognizing them and seeking medical attention immediately can mean the difference between a full life and permanent disability. In this video, I will guide you through the hidden signs that may appear days before a stroke, why they matter, and what you should do if you or someone you love experiences them. Before we begin, I want to hear from you. Have you or someone close to you ever experienced sudden dizziness, slurred speech, or numbness that disappeared after a short time? Share your story in the comments, because what you say may help another person recognize the danger in time and save a life. 1. Sudden numbness or weakness. One of the clearest and most alarming warnings that a stroke may be approaching is sudden numbness or weakness, especially when it affects only one side of the body. This may involve the face, an arm, or a leg, and often it comes without warning. You might notice that your smile looks uneven in the mirror, or that one side of your mouth feels heavy. Perhaps you try to lift your arm and it will not rise as it should. Or your grip suddenly feels weaker than usual. Some people notice their leg dragging slightly when they walk, or that they are unable to stand firmly on one side. These changes may appear for only a few minutes and then disappear. But this does not make them harmless. In fact, this temporary weakness is often the body's way of signaling that a major stroke could be imminent. What causes this sudden weakness is usually a blockage in blood flow to a specific region of the brain. When brain cells in the motor areas do not receive oxygen, they fail to control the muscles properly. If the blockage clears quickly, the symptoms may vanish, leading many people to believe that the problem was minor or unimportant. This is a dangerous misconception. Doctors call these episodes transient ischemic attacks, or mini strokes. They are not mild events. They are warnings. Statistics show that many people who experience a mini stroke will suffer a full stroke within days or weeks if nothing is done. This is why numbness or weakness, even if it fades, must always be taken seriously. Think of it as a rehearsal, a smaller event before the main attack, giving you the rare chance to intervene before permanent damage occurs. The mistake many make is attributing the weakness to fatigue, poor posture, or even sleeping in the wrong position. While those causes can explain mild discomfort, sudden loss of strength on one side of the body is never normal and must not be ignored. The correct response is immediate medical evaluation, because only imaging and clinical examination can determine whether a clot or bleeding is threatening the brain. The longer you wait, the higher the chance that the next episode will not resolve and will leave lasting disability. Imagine not being able to walk, hold a spoon, or hug your loved ones because of paralysis that could have been prevented. That is the risk you take when you dismiss these signals. The good news is that if you respond quickly, doctors can take steps to reduce the danger. They may prescribe medication to thin the blood, manage blood pressure, or remove a clot before it causes permanent harm. Lifestyle adjustments such as controlling diabetes, quitting smoking, and maintaining a healthy diet also reduce the likelihood of recurrence. Remember, sudden weakness or numbness is not a random inconvenience. It is one of the body's strongest alarms. If you or someone you know experiences it, act immediately, call emergency services, seek urgent care, and treat the event as seriously as you would treat a fire in your home. Quick action can extinguish the threat before it destroys what matters most: your independence, your speech, your movement, and your future. 2. Sudden speech problems. Another critical warning sign that a stroke may be days away is the sudden onset of speech problems. Language is one of the most delicate functions of the brain. And when the blood supply to areas that control speech and comprehension is interrupted, even briefly, the ability to communicate can be lost. This may begin subtly. You might notice that words come out slurred, that your tongue feels heavy, or that you cannot pronounce simple syllables clearly. For some, the issue appears as difficulty finding the right word, substituting one word for another, or speaking in a way that does not make sense to those listening. In other cases, you may hear someone try to repeat a simple sentence, but the words come out garbled or incomplete. These moments are frightening, but they are also vital clues, just like sudden weakness. Speech disturbances may last only a few minutes and then resolve completely. Many people dismiss these episodes as fatigue, nervousness, or even a temporary lapse in concentration. That assumption can be deadly. What is actually happening is that blood flow to the language centers of the brain is being disrupted. If this disruption becomes permanent, the result is aphasia, a condition where a person can no longer speak, understand, read, or write normally. The burden this places on daily life is enormous, robbing someone of their independence and ability to connect with others. Doctors classify these short-lived events as transient ischemic attacks, or mini-strokes, which are red alerts that a full stroke is very likely to follow if no action is taken. Imagine trying to call for help during a stroke, but being unable to speak clearly enough for anyone to understand you. That is why even temporary speech problems must always be treated as emergencies. If you or a loved one notices sudden slurring, incomprehensible speech, or inability to repeat simple sentences, the correct response is immediate medical attention. Do not wait to see if it improves on its own. Time is brain, and every delay allows damage to spread. Seeking urgent care may allow doctors to identify underlying conditions such as atrial fibrillation, carotid artery narrowing, or high blood pressure that triggered the episode. Treatments ranging from medications to procedures can reduce the chance of a major stroke. Lifestyle changes, including quitting smoking, limiting alcohol, controlling diabetes, and managing stress, also play a role in protecting language function. The ability to speak and to understand others is one of the most human of all skills. Losing it in seconds because a warning was ignored is a tragedy that can be prevented. Always remember, sudden speech problems are not normal. They are one of the brain's loudest cries for help. Treat them as a medical emergency. Call for assistance immediately and act quickly to protect your voice, your independence, and your future. 3. Sudden vision loss or blurred vision. Your eyes are often described as the windows to your brain. And for good reason. The delicate nerves and blood vessels that make vision possible are directly connected to the brain's visual centers. When blood flow to these areas is disrupted, even briefly, the result can be sudden blurred vision or complete vision loss in one or both eyes. This is one of the most overlooked warnings that a stroke may be approaching. Many people dismiss temporary changes in eyesight as fatigue, aging, or eye strain. But these sudden shifts can be the brain's way of signaling a serious threat. Imagine reading a book and finding that the words blur unexpectedly, or looking across a room and realizing that one eye no longer provides clear sight. Some describe seeing double, while others notice a dark shadow creeping across part of their visual field. These experiences may last only minutes, but they are never harmless. What is happening is that the blood supply to the part of the brain responsible for vision has been cut off or reduced. If the blockage clears, vision may return, but if it does not, the result can be permanent blindness in part of the visual field. This condition is not an isolated eye problem. It is a neurological emergency that often predicts a full stroke within days. Vision disturbances during a transient ischemic attack may be the only warning you receive before a major event. Ignoring them is like ignoring smoke before a fire. Once the stroke strikes, recovery of vision is rarely complete, leaving people unable to drive, read, or even recognize the faces of loved ones. These consequences can strip away independence and quality of life. The tragedy is that vision changes are often attributed to something minor, causing dangerous delays in seeking care. The correct response to sudden blurred vision, double vision, or loss of vision is immediate medical evaluation. Emergency imaging can identify clots, narrowed arteries, or bleeding that may be threatening the brain. Treatment may involve medications that thin the blood, procedures to remove blockages, or interventions to control high blood pressure and cholesterol. Lifestyle adjustments also matter. Protecting vascular health through diet, exercise, and quitting smoking helps prevent future episodes. Eye health cannot be separated from brain health, and any sudden change in sight should be taken as seriously as sudden weakness or slurred speech. Consider how devastating it would be to lose the ability to see your family, enjoy a sunset, or safely walk through your own home. These are the stakes when vision loss is ignored. By recognizing the warning early and acting without delay, you can prevent that loss and protect both your eyesight and your life. Remember, sudden vision changes are not just eye problems. They are urgent neurological alarms. Treat them as a sign to act immediately and seek emergency care. Because every minute counts when it comes to saving sight and preserving brain function. 4. Sudden loss of balance or dizziness. Another important warning sign that a stroke may be days away is the sudden onset of dizziness or loss of balance. The brain has dedicated regions that coordinate movement, posture, and spatial awareness. When blood flow to these areas is reduced or interrupted, even briefly, the result can be staggering, unsteadiness, or the feeling that the world is spinning. Many people dismiss these moments as a sign of fatigue, dehydration, or inner ear trouble. But when dizziness appears abruptly and without clear reason, especially when combined with other neurological symptoms, it must be treated as a potential stroke warning. Imagine rising from your chair and suddenly being unable to stand firmly, or walking down a hallway only to feel your body veer to one side as if pulled by an invisible force. Some people describe their legs giving way beneath them, while others report that they cannot coordinate their arms and legs to perform simple tasks. These symptoms reflect a disruption in the brain's ability to manage balance and coordination. They may vanish after a few minutes, tempting you to believe the problem has passed. In reality, they may represent a transient ischemic attack, a temporary interruption of blood supply that often precedes a major stroke. Ignoring these signs can be catastrophic. Falls caused by sudden loss of balance may cause injuries, such as fractures or head trauma, which in older adults can be life-threatening on their own. But beyond the fall itself, the underlying cause is what makes this symptom so dangerous. A blockage or bleed in the brain that interferes with balance is a clear sign that the vascular system is under stress and at risk of complete failure. The correct response to unexplained dizziness or sudden loss of balance is immediate medical attention. Emergency evaluation can determine whether the event is linked to a mini-stroke, heart rhythm disturbance, or another vascular issue that requires urgent treatment. Doctors may use brain scans, blood tests, and cardiac monitoring to uncover the cause. And they can begin interventions such as blood-thinning medication or procedures to restore circulation. Preventive care plays a role here as well. Keeping blood pressure under control, managing diabetes, maintaining healthy cholesterol levels, and staying physically active all strengthen the body's defenses against these dangerous episodes. Exercises that build balance, such as Tai Chi or yoga, can provide added protection. But they cannot replace the need for medical care when sudden symptoms strike. Consider the consequences of ignoring such a warning. A person may fall, suffer a fracture, lose independence, and then days later experience a full stroke that leaves them permanently disabled. All of this could be prevented by recognizing that sudden dizziness or imbalance is not trivial. It is the brain's alarm, demanding attention before greater damage occurs. If you or someone you love experiences an abrupt inability to walk straight, stand firm, or coordinate movements, call for help immediately. Do not wait to see if it resolves. Time lost is brain lost, and each minute of delay increases the risk of a disabling or deadly stroke. 5. Sudden severe headache without cause. Perhaps the most frightening and often misunderstood warning sign of a stroke is the sudden onset of a severe headache that appears without any clear cause. While headaches are common and may arise from stress, tension, or fatigue, a headache linked to an impending stroke is different. Patients often describe it as the worst headache of their life, striking abruptly like a thunderclap and reaching peak intensity within moments. Unlike ordinary headaches that build gradually or respond to rest and medication, this pain can be overwhelming, relentless, and accompanied by other neurological symptoms. What makes such headaches alarming is their underlying cause. In many cases, a sudden severe headache reflects bleeding within the brain due to a ruptured blood vessel. This hemorrhagic form of stroke places immense pressure on surrounding brain tissue and deprives it of oxygen. Even when bleeding has not yet occurred, extreme vascular stress can trigger pain as vessels struggle under high pressure. Ignoring such a headache is dangerous because the damage can escalate rapidly, leading to permanent brain injury or death within hours. The tragedy is that many people treat these headaches as migraines or stress-related pain, choosing to rest or take over-the-counter medication instead of seeking urgent care. This delay can cost them the chance to survive without disability. A sudden severe headache should always be seen as a red flag. especially when it occurs in someone with risk factors such as high blood pressure, diabetes, smoking, or a history of cardiovascular disease. Additional warning signs may include nausea, vomiting, vision disturbances, dizziness, or sudden confusion. When these symptoms appear together, the likelihood of a stroke is extremely high. The correct response is immediate medical evaluation in an emergency setting. Doctors can use imaging tests such as CT scans or MRI to determine whether bleeding or blockage is occurring and can act quickly to stop further damage. Treatments may include medications to control blood pressure, dissolve clots, or even surgical interventions to repair ruptured vessels. Quick action in these cases can mean the difference between recovery and devastating loss of function. Preventing such headaches from escalating into a full stroke requires more than just responding to the event. It involves controlling the risk factors that weaken blood vessels in the first place. Keeping blood pressure within safe limits, avoiding tobacco, limiting alcohol, managing cholesterol, and maintaining a healthy weight all reduce the strain that can cause vessels to rupture. Stress management and regular checkups are equally important, since hidden vascular issues can often be detected before they cause pain. Imagine losing the ability to speak, move, or even recognize loved ones simply because a sudden severe headache was dismissed as something minor. That is the reality faced by too many people who ignore this critical signal. Always remember, not all headaches are created equal. A thunderclap headache without cause is not ordinary pain. It is a neurological emergency. Treat it as the brain's desperate call for help, and act immediately to protect your life and your future. Doctor's final words. As a brain doctor, I want you to remember this above all else. Stroke is not always a sudden event that comes without notice. In many cases, your body sends signals days before, sometimes even a full week in advance. Numbness or weakness on one side of the body, sudden trouble speaking, unexpected vision loss, unexplained dizziness, and severe headaches without cause are not random inconveniences. They are alarms, warning that blood flow to the brain is unstable and that a devastating stroke may be near. The tragedy is that too many people dismiss these signs as fatigue, stress, or aging, losing the chance to prevent disaster. The hopeful truth is that immediate recognition and urgent action can change everything. If you or someone you love experiences these symptoms, do not wait and do not ignore them. Seek emergency care right away. Doctors can intervene, stabilize blood flow, and in many cases stop a small warning event from turning into a major, life-altering stroke. Prevention does not end with emergency care. It continues with consistent attention to blood pressure, blood sugar, cholesterol, and overall lifestyle. Eating a balanced diet, exercising regularly, quitting smoking, limiting alcohol, and managing stress all build long-term protection for your brain. Regular checkups ensure that silent problems are caught before they erupt. Stroke is not simply a medical condition. It is a turning point that can steal speech, movement, independence, and dignity in a matter of minutes. But by listening to your body, respecting its warnings, and acting quickly, you can protect yourself. Before we close, I want to hear from you. Have you ever experienced sudden dizziness, blurred vision, or weakness that resolved on its own? Share your story in the comments, because your experience could help someone else recognize these dangers in time and possibly save a life. Remember, prevention is power. Take these signs seriously. Act without delay. And give yourself the best chance for a strong, healthy future.